In this video, Julia and I want to demonstrate how to do an effective cupping of iliotibial band syndrome above the knee. It's a pretty common issue with people who run, sometimes with people who walk, and it happens when the iliotibial band, which is this long tendinous band right here attaching to a muscle on the side of the hip, frictions with the underlying quad muscle and creates an area of soft tissue adhesion. So the cupping is really good to try to lift the iliotibial band away from the quad. So the cup that you need for this is a wide, flexible cup, and you always need your glide agent. And before I start that, you need to understand that the cupping of the iliotibial band is the last thing you're going to do after you try to figure out why you're developing iliotibial band syndrome. Has to do with alignment of the pelvis, muscle balance, maybe pronation. So you definitely need to work that up at first with your chiropractor. Um, as always, we're going to apply the glide agent and we're going to focus on an area just above the kneecap to about like the middle or 2/3 of the thigh. You're going to put your cup at about 50% of suction. Refer to the Cupping 101 video if that doesn't make sense to you. And I'm going to start by putting the cup just above the knee right here, okay? Making sure we've got a good grip that we can mobilize it. And then Julia's going to place her foot on either a ball or on my foam roller so that she can flex and extend the knee while she cups. So first we're going to do our circular motion and glide just a little bit with every movement of the leg. And so I'm going to let Julia take over. So you can cup yourself at home and treat that in between your long runs. Good. Very nice. So it's just a little bit uncomfortable, but it also feels really good. It is going to release the tension on the side of the leg. And we're going to go to about this area right here. And then we're going to unseal the cup. And typically I tell people do 2 slow passes to treat the iliotibial band and maybe do that like 2 or 3 times a week. You don't want to do it every day. So we're going to do it one more time. You can bend your knee a little bit. Good. And then we're going to go up. We're going to bend your knee a little more. There we go. So we get some really good glide and separation of the iliotibial band away from the quad. One more time. Very well. And then we're going to unseal the cup and we're done. I hope the information has been helpful and we look forward to seeing you in the next video.